Junior, okay, yeah.
Okay,
Good.
it's preparing the live streaming. Hold on.
Thank you, Kim. So it looks
right,
like we're live, from what I can tell.
Yep.
Welcome to the April Board of Health meeting. I'd like to call the meeting to order. I'm glad to see you are all well. We have minutes before you that Kim has graciously prepared. May I have a motion for their approval?
So moved, Ken Edwards.
Dr. Edwards moved. Is there a second?
Second, Vanessa Brown.
Okay, Vanessa Brown, second. Is there any discussion? Just thanks to Kim. All those in favor?
Aye.
Opposed?
Aye.
Motion carried. Today, I understand that our business manager is on vacation and we do not have vouchers. Nikki, is there anything unusual in the vouchers that we should know about?
So so we don't have a voucher report that has been run from Munis that you would typically see. And nobody who's currently in the office knows how to do that either. So I apologize for that. I do know that we have been watching what has been happening as purchases have gone into the system, and there is nothing unusual that has that would have shown up in that voucher report. So I think it would probably be acceptable if the group does not want to do any sort of approval, and we can make sure that you see 2 months worth of reports at the next board meeting.
I would be more comfortable with that. Linda, do you have a question or comment?
How long will it be until somebody is able to run that report in the office?
So Craig knows how to do it. I mean, being very candid, this was just an oversight. So Lisa's last day was Friday the 26th, and our new business manager was in the office that week. And then she had 2 days last week before there was a pre-approved trip that we had worked out during the hiring process. So we have staff that know how to do it, but in some of that transition, we missed it before everybody left the office as we were preparing the board material. So it was a pure oversight. Craig definitely knows how to do it. Jennifer, our new business manager, will know how to do it next week. We just can't get the one report in that format out of the system.
We are amazed how many balls you're able to keep in the air. So this is the least of our worries. So thank you.
Thank you.
All right, we're moving on to one resolution on the agenda from the United Way.
Yes, so this is an amendment it's one resolution for actually amending the 2 agreements we have with United Way. These are our grant amendments or grant contracts that support the PPP program and NFP. So the United Way has extended funding for another year at the status quo level. They have opted to extended the 3-year funding that should have ended in 2020. They extended it into 2021 because of COVID, and based on the length of what is happening and the adjustment in so many funded partners' operations, they've opted to extend that 1 more year. So our grants will expire in 2022. So we expect that next year is when we would be reapplying for funding.
Wow, it's awfully gracious, isn't it?
It is.
Good. All right, so you have the United Way resolution to extend in front of you. May I have a motion for approval?
This is Ray. I'll move we accept as it is written. I'm sorry.
It's all right. Okay, we have Ray motioning. May I have a second, please?
Second, Dwayne McBride.
Okay, Dr. McBride, second. Any discussion? Just if you would, Nikki, just let United Way know our pleasure.
Yes.
That really is a funder. That's so intelligent. All those in favor?
Aye.
Opposed? Motion carried. My goodness, look at all the people with 20 years. That's just absolutely amazing.
People.
Yes, spring of 2001 was definitely a hiring boom.
That's fabulous and such good people too. Yeah,
Yes.
all right.
So first we have Shannon Larry Burton to recognize, and I'm going to have Lisa Peoples-Hurst start off. Lisa is Shannon's supervisor and longtime colleague. So Lisa, I'll let you go ahead and do some opening recognition.
Okay, good morning, everyone.
Good morning.
It is my pleasure to help honor Shannon Larry Burton for her 20-year anniversary today. We started 3 months apart back in 2001. So we've been here for a long time. We started together in health promotion, then it went to be called substance abuse prevention. It went to be called substance use disorder prevention, and now public health promotion and prevention. So together we have seen all the changes in our department and actually in our field. But I just want to share with you this morning some of the things that Shannon has remained a champion of. She's truly passionate about the work that we do. She was the first in our department to obtain her certified prevention consultant credential, which is actually a step above the certified prevention specialist. So she had earned enough hours, clinical hours, supervision, and discipline in our field to be able to obtain that first. She serves as our designated youth tobacco use representative for the state of Michigan, which means that she coordinates SINAR efforts. And for those of you that may not be aware, the state relies on SINAR compliance for the state. That's how we get our tobacco money back. And our state, each state has to maintain at least 85% compliance. And Shannon has been the DYTUR for many, many years, as Berrien County has always participated in that effort. She serves as a certified freedom from smoking clinic facilitator. So those smoking cessation classes that we discussed a number of months ago, she is certified to teach those classes. She coordinates our tobacco or vaping and tobacco vendor education and compliance checks. She is the champion of our vaping and tobacco prevention campaign. She serves as the chair of our community services roundtable. She has represented us on the Triad Steering Committee, as well as the Suicide Prevention Coalition. She is also certified to train a trainer in the naloxone, which is the reversal drug procedures. And in addition to all the other things that we do in prevention, the fact that our role in helping with the COVID-19 disease surveillance is case investigation, and we all are involved in case investigation as well as our prevention duties. So just by that short list, which is not an exhaustive list, you can see the dedication that Shannon has provided to our department in the last 20 years, and definitely deserves this service recognition today. Definitely.
Oh, wonderful, Shannon. Thank you so much for your good work. Wow.
And Courtney, I see you've just joined. Would you like to add some?
Yes, thank you. And I apologize for being late this morning and not having a camera. I'm in my car, but I will join soon. But yes, thank you. Shannon has always been a great member of our team. I just can't say enough about the last couple years of working with her and her adaptability and willingness to do what our community needs. So I think she really embodies prevention specialist in that holistic term of, you know, she's part of our substance use disorder prevention team, but really is willing to go above and beyond and support our community in whatever way she can with that skill set and really think about prevention in that way. I mean, she has been a case investigator over the last year and has done an amazing job supporting families. You can see the care and the relationship she builds with people. It's not just a call, it's someone that she is taking care of. She has amazing relationships with all of the vendors that she has in the community. I think she takes a lot of pride in those relationships and the pride in the work that she does. Shannon really cares about the image of the health department and what she is bringing to all of the work that she does. And I'm very grateful for that, Shannon. So thank you. It is definitely seen in your day-to-day work, and 20 years, congratulations. That's really awesome.
And I just want to echo all of the things. I've seen Shannon be so willing to join in department-wide initiatives when it was strategic planning groups and when we've had our quality improvement and all sorts of things. Shannon is always willing to learn new things, to try new things, and join efforts beyond just her daily responsibilities and the duties in her job description. So Shannon, we're really, really grateful. Your hard work over the course of 20 years really has led to a stable and solid, impactful program. So thank you.
Thank you, guys. I just want to say thank you to the board, you, Nikki, Courtney, and Lisa, for allowing me to provide prevention services, not only just to the community in which I was born and raised in, but for allowing me to provide prevention services throughout Berrien County for 20 years. So thank you, guys.
Yeah. Glad to have
Thank you.
Thank
That's
you.
amazing.
Good job.
All right.
And I'm going to jump off because I'm on my way to a clinic now.
All right. Thank you, Ms. Lisa.
Thank you, Shannon.
Yes.
Thank you.
Have a
you.
good day,
Bye, Shannon.
everyone.
Thank you.
And on a similar note, there are other 3 individuals that we are recognizing could not be here for various reasons, but also including we're running vaccine clinics all over town these days. If it's okay with you, Peg, I'll move in and give some remarks. Unfortunately, supervisors are also not able to be here. So next, we do want to recognize and honor Shirley Polk-Miller. She has been here for 20 years as well. She is currently our patient billing specialist and has been in that role for as long as I've been at the health department, so at least 12 years. But I do know that when she started at the health department, she was actually an educator in a pregnancy prevention program. So she made a little bit of a pivot, which is always really great when we can keep talent at the department and find a role for people as programs kind of come and go. So Shirley has been a member of our finance team for a number of years. She does a really great job of working with our clinical clerical staff. There has been, especially with our newer EMR, Patagonia, there has been a lot more billing information and billing processes that have been put upon our clinical clerical staff that was not the case previously. So she's really helped them transition into that new part of their role, answer questions, make sure that our claims are getting out the door in a clean way that maximizes their chance of acceptance the first go around. And she spends lots of time troubleshooting things. So it doesn't always sound like a glamorous job. And there's a lot of hard, tedious work that she has to do. But she's incredibly sharp. She knows the rules. She figures out what needs to happen. And we're really grateful for that work. It's incredibly important for our department.
All right. Well, thank her for us. That's amazing. Good.
All right, so we'll move to Kathy Martin next. Kathy's a public health nurse. She's with our sexual health team, and she has been a part of that team for 20 years. She does an excellent job of serving our clients, really trying to meet their needs. And then she's also has really been a huge part of our vaccination effort over the last 3 or 4 months. She's willing to do new things. When you try to pull her in to say, okay, we've got to be flexible, we've got to try to do this new thing, she's always willing to give it a go. So we appreciate Kathy for her 20 years of service as well. And then lastly, we have Barb Carter. Barb Carter is started off at the health department as a public health nurse and was really involved in disease investigation and immunizations and all of that. It's probably been 6 or 7 years now that she made a switch to be an NFP home visitor. So she's now a nurse in the home visit in the NFP program. She does a phenomenal job building relationships with her clients. Courtney, I know you have more experience with her in the NFP. Do you have any words you'd like to say about Barb?
Yeah, absolutely. Barb is definitely one of our team members who just, again, gives a lot of care to community members. Her families that she works with in NFP, I know she just has a lot of over and above time with them, really wants to ensure that she is there as a supportive role. Again, I think that as most of and all of our NFP team are, it's not just a job. This is a calling. It is something that they show up every day knowing that they're there to support our community and have our next generation raised healthy. So I think that that is just a really special thing that she's been able to do. Again, like all of our team, both Barb and Kathy are at a clinic this morning. They have been pushed and pulled and helped with case investigation and clinics. And through that all, one thing that I will just know is it is still a family-centric focus that Barb has. So even in that case investigation time or now doing vaccinations, it is a priority for her to still be checking in on her families. I know that there is a lot of care and concern and worry that is there still. And so I just value that part has not just been set aside, but is still a very instrumental part of why she shows up every day and serves the community. And I'm grateful for that.
That's
So we
wonderful.
continue to just have a great team. We're really grateful. We have longevity of these 4 women on our team, as well as many of our other staff. We're very lucky that we continue to have some of this longevity. It's not as common anymore.
Oh, that's wonderful. Please let everyone know our appreciation as well. I mean, that's just keeping those clinics going. That's extraordinary. So thank you.
Thank you.
All right. Moving on to the Health Department Administration.
Yeah, so wanted to give you some updates on some of our staffing transitions. As you know, last month, Lisa Ankenbrook resigned as our business manager to pursue some other opportunities. We were able to hire Jennifer Kelly Priest, who has a unique background in both finance and social work. So we're really pleased that she has joined our team. Her first day with us was March 22nd, the Monday before Lisa left. So they were able to have about a week of some overlap, do a little bit of orientation to here's the types of things that we do. Jennifer comes to us with extensive experience at Whirlpool in their finance department. So she's got a lot of public sector experience. I believe she's got all of the right skills and she'll be able to translate into the government accounting and public accounting and all the things that we do. I think she'll fit in real well. And I think she will do a good job as the leader of our finance team. And I think this position was also of particular interest to her with her social work background and interest as well. I think she cares deeply about the heart of our mission and the people we serve. So we're really grateful for that. We're really looking forward to next week when she returns to the office so that we have a chance to start going quite a bit deeper, but we're pleased with that hire and are really rapidly working through that transition. And we're grateful to Craig and Laura and Shirley on the finance team who have really been able to keep things going as we're working through this transition. So that's really grateful for that. And then just wanted to give you all an update on the medical director search. As we know, our time with Dr. J is limited. So we are working through that process. It's such an important position. We did issue a request for applications that went out through some hopefully pretty broad networks. We've got it listed through some state networks as well as through some of our regional healthcare provider networks. We definitely want to prioritize somebody who has relationships in Berrien County and in this region. We know that will be incredibly helpful, but we wanted to make sure we also had multiple applicants to choose from too. I think that can help strengthen the process. So we have received, I believe, 2 applications so far. They've got till next week. And then the following week, we will be convening an interview committee that will be comprised of a few members of the health department staff. We've got Peg and Dr. Edwards from the Board of Health that will be on that selection committee. as well as our Commissioner Harrison and Shelley Jasper from county personnel. So we've got a 7-person team that I think will do a good job of being able to sift through that. Our goal is to make sure that we have somebody identified, hopefully in early to mid-May, so that we can get through the contracting process, still have some overlap. There's lots of things that are with Dr. J's name and his NPI number and all of these things that we want to make sure we get transitioned over in time for a smooth transition. So we're working through that process now.
May it go well.
Thank you.
Big shoes to fill, Dr. J there. All right, and does anyone have any questions of Nikki about the hire or the process for the medical director? All right, looks like the Board of Commissioners was able to do some resolutions in our absence.
Yes, so we had a couple of things that we needed to move quickly and just didn't meet the Board of Health cadence, but wanted to just make you aware. There was a resolution last Thursday that was approved. Thank you to Commissioner Harrison for your help in shepherding this. But to add a public health nurse to the health department complement. We have some temporary nurses right now that they are rapidly approaching their 1,000-hour cap, and we know we're going to be doing vaccination for a few more months. It's going to shift as to what it's going to look like, but we wanted to make sure that we were able to retain some of the talent and the people that have been with us for a period of time. So we also recognize and have informal notice that there is likely to be a retirement or two amongst our public health nursing team in the fall. So we had requested and were approved by the Board of Commissioners to add 1 full-time public health nurse position. That would allow a temp to be able to potentially move into that full-time position. We could backfill that temporary position. And then after some of the COVID settles down and COVID funding starts to decrease, we would be able to lose 1 position by attrition so that we don't get ourselves into a situation where we have a position we can't afford. So that is our plan. We're doing everything we can to maximize vaccinators, and this was one part of that strategy.
Great.
The second one is a contract with the Woodland Shores Baptist Church. A lot of this was a formality. We did hold a clinic there last week, and as part of their process for using the space for events is to have a contract in place. We will be returning to Woodland Shores Baptist Church at the end of April for second doses to that clinic that we held last week. There was no money that exchanged hands. The church graciously gave us their space for free, as have many faith-based partners and other community partners, but this one required a contract. So we sent that through Board of Commissioners on a pretty short timeline.
All right, good. Thank you, Dr. Harrison, for your help there. That's great. So good. All right, moving to what has raised the questions before we went live, the COVID report.
Yes, so I'm sorry you're hearing a lot from me today, just because we're a little bit lighter on our other staff. I'm going to go ahead and share some slides, as has become a bit more of our routine. And we'll talk through some of the data to get started. So it's definitely been a hot topic. What's going on in Michigan? It's definitely been in the national news. Berrien County has been a little bit different than what's happening in the rest of the state at this point in time. We know that things can change rather rapidly, but when we look at our cases, this is our curve throughout the whole pandemic. So here's where we peaked out in November. We had a little bit in January where cases started to go back up and then fairly quickly went back down. And then in February and into March, we started to see a bit more of an increase again. We are now averaging between 50 and 55 new cases per day. However, over the last week or so, the increasing trend has leveled off a bit. We are not increasing over the last 10 days at the same rate we were 10 days before that. Things are starting to flatten out. It's It's hard to predict if that's going to really just go back down again, like we saw in January, or if this is just going to be a little bit of a flat period before it continues to go up. But this is what we're seeing here in Berrien. When we look at the percent positivity, our percent positivity as our number of cases has gone up, it has followed a similar pattern. I mean, it stands to reason more cases, you have a higher percent positivity, but we are above that 10% mark now. And so that definitely gives us a little bit of pause and something that we're watching. Our amount of testing that we're doing remains relatively flat. So it's always a good reminder. People know that if they're experiencing symptoms, we would encourage them to be tested. There are lots of testing locations. These can all be found on our website as well. But we've been averaging about 500 tests per day in our county. We continue to be one of the communities that has some of the highest testing rates in our region and in the state. As well. So it's good that we do have all of those resources. When we look at our hospitalizations, and this is probably the one that everybody is tracking most closely, we have seen a little bit of an increase, a lot at, somewhat in line with our increase in cases. For quite some time, we were around 10 or so people on average in the hospital with a positive COVID test per day. That has now increased to closer to 30. However, it's been a little bit more stable in the last few days as well. So again, it's hard to say whether this plateau will continue or is the beginning of a decrease. We need more time to know what the data is going to do. Even though the numbers are higher than they were, we are grateful that our healthcare system is not at capacity and that they're still doing an excellent job of providing healthcare to both COVID and non-COVID patients. We don't want to take that for granted, and we do want to make sure that we're monitoring things, but there are some counties in the state where their health systems are closer to capacity. I think we're doing fairly well in Berrien at the moment. When we look at our death trends, there's usually a little bit of a lag in the deaths and with the hospitalizations. Right now, I mean, we had one unusual day where there were 3 deaths in early March, but it's been fairly sporadic or closer to what we were seeing earlier in the winter. Since then, so we have not seen a sharp increase in our deaths. I do believe a lot of that could also be attributed to the fact that, and you'll see this in later slides, we do have really good coverage of our older adults in terms of vaccination. We know that vaccination is going to do a good job of preventing hospitalizations and deaths, even if it's not 100% perfect in preventing infections. So it is a little bit hard to compare what we're seeing right now with our increase in cases and our increase in hospitalizations compared to what happened in October and November, because our population has dramatically different susceptibility rates. There's just a dramatic difference in who is susceptible and how many people are susceptible to illness at this point. The cases are definitely skewing younger, but as are some of the hospitalizations, and that is more a reflection, I believe, of who's been covered in terms of vaccination. Now, these next few slides I'm going to show you, it's similar data to what we've already seen, and it's really busy, so don't get overwhelmed by that. This light blue line you see peeking through here, this is Berrien, and all the others are just the other counties in our region, and the blue dots with the solid line is the state. So this is the daily cases per million. So it's in that rate so we can compare. And you can see that Berrien really over the last month or so has been just a little bit lower than the rest of what we're seeing in the region. Now, this downward slope here is usually an artifact of just reporting that the cases have happened, but they may not have been into the reporting system. So usually the last day or so of data looks like a decline. But at the same time, we're just not seeing cases at the same rate as some of our regional partners. And it's been that way for a few weeks. So it's hard to explain exactly why. But we are performing better than the region in that regard. When we look at how many people we're testing, we also remain high. we're at a high level. Calhoun is the only one that has been outperforming us in doing tests. So we're not necessarily low because we're not doing the testing, but we are seeing this. So that is a little bit reassuring. And then when we just look at the positive test rate, as you would imagine, because that's a function of how many tests you're doing and how many cases you're finding, we're doing a lot of tests, but we're not finding as many cases. You can see that our percent positivity here, this blue line, is just lower than what is being seen in our region. So it's a little bit tricky to make sense. We can't identify any type of causal relationships as to why that might be, but just to give you a sense of where we're at. I did go through and look at a comparison of the cases per million by county, and Berrien was like 63rd on that list and 5 times lower than some of the higher counties. So what is being experienced in some parts of the state is not being experienced here. So the next section I have is on vaccination. And I guess, Peg, would you like me to just move through vaccination and take all the questions at the same time?
I think that would be logical because people would have the whole information. Thank you.
Okay, yep. So just to get into what the vaccination efforts have looked like, this table is showing vaccine administered to Berrien residents. So it doesn't necessarily reflect the total effort of the providers, because we do know we've vaccinated people that don't live in our county, but it's a pretty good estimation, and it's showing how well our folks are covered. So as of about 2 days ago, the health department, we have administered nearly 30,000 doses of vaccine. 18,600 were first doses, and then it was close to 11,000 were second doses. The hospital has done 18,000 doses, and pharmacies have done 20,000. Our pharmacy partners have been instrumental in the coverage rates. And then there have been our FQHCs, we've had some primary care, there have been some other providers in here that have given over 4,000. So 72,000 doses of vaccine have been provided in Berrien County, and that represents 46,000 individuals that have received at least a first dose of vaccine, and another 26,000 that are considered fully covered because they've received their second dose. So overall, given that this has been about a 3.5-month effort at this point in time, this is phenomenal. It's not on scale, like there's nothing else we've ever done that's been on the same type of scale. So I'm really proud of our team and what they have really been able to accomplish here. When we look at coverage and what that really means for us, and this is pulled from the state dashboard, but this is specific to Berrien County, you can see how we've increased in the amount of vaccination that has happened. And at the beginning of March, when the Johnson & Johnson vaccine was approved, that started to increase some of our vaccine allocation. You can see that the slope of the line here increased, and we started getting here faster as more vaccinations were available. A little bit of a plateau, spring break week, it's harder to get people in for, we'll see how this plays out over the next few days. But what I really want to point out is this is the COVID coverage by age group. And so in the 75 plus, we have over 70%, 71% of adults, 75 plus have initiated vaccination. Over 60% are fully covered. They've completed their series. And those 65 to 74, it's 69% have initiated, 55% have completed. Now it does drop off quite a bit below that, but we also know these age groups have had a lot more time to be vaccinated, and we really did focus a lot on our older adults until March when things started opening up. But amongst our 50 to 64-year-olds, we're seeing high rates of initiation, 42%, and it's been less than a month since that group has been eligible for vaccination. And then so on down the line. So we're seeing, I think, really good coverage. We've got really strong coverage at the ages that matter the most for vulnerability. And then this next slide just shows you a little bit of a trend line, and it might be a little bit harder to see on your screen. Here on the left is the state of Michigan's vaccine distributed to the state. And then this is the amount of vaccine distributed to Berrien County. So not necessarily administered, but when the vaccines were given to the community. So you can see, I mean, there's been a pretty significant upward trend in the amount of vaccine available in the state at the end of February. And then Berrien County has seen similar increases. So it's been a fairly steady increase. We've had some unusual weeks where we've gotten a seeming windfall, then it's been a little lower, and then it's gone back up. We're seeing some of that ebb and flow. Our team is doing a phenomenal job managing that and managing some of the unknowns. There are some processes that are smoothing out that are making these things more predictable and making it easier for us as the health department to direct which partners are able to get vaccine in hand as well. That's just going to become increasingly important as we need more partners to do vaccination and not to be shouldering a lot of this burden on our own or just with the hospital. So lots of very competent partners we're working to get vaccine to, but overall the amount that's coming is increasing. And then the last thing in this section is just really, there's still a lot of things that are just unknown. And there's a lot of things that we're watching. We're definitely paying attention to variant strains. We have around 20 confirmed or suspect cases of B117. A confirmed case is one that has actually been confirmed in the lab to be that variant strain. Suspect is a close contact that became ill as a result of contact with a confirmed variant case. So if that person had a positive COVID test, it is assumed that it is the variant, and then they are a suspect variant case. We're definitely paying attention to that. We do know that when a variant strain enters a community, evidence has shown that it does become a predominant strain and more common fairly quickly with the variant. And Dr. J can speak to this in more detail, but they're not necessarily considered more harmful or causing worse illness, but they are more infectious. So you may have more people infected more quickly. And as we all know, more people infected, even if a very small percentage are the ones hospitalized, that number also increases. Also watching just what has happened with breakthrough cases in the state. We know that a lot of health jurisdictions are reporting a small handful of cases, positive cases amongst people who have been vaccinated. That is a somewhat normal thing to happen as vaccines are not 100% efficacious. And then as we've been talking about, there's just rising case trends in many other parts of the state. On the other side of things with the vaccine, we are definitely continuing to pay attention to and try to, along with partners, address some issues of vaccine hesitancy. And we are definitely approaching an inflection point where the demand was so much higher than the supply that you could fill clinic appointments almost instantly. People would take any time that was available because they were willing to inconvenience themselves to get this scarce commodity. Very grateful that supply has increased, but as the supply has increased, the demand is also leveling off. So it is taking longer to fill clinics. We are filling clinics and getting all of those appointments filled, but we're also seeing a small uptick in some of our no-show rates. We used to have 100% show rate in January, February, and even the beginning of March, and now there's just more no-shows. So from an operational standpoint, we're just making sure how to compensate for that as that shifts over time, because if you expect somebody to come and you thaw a dose for them and then they don't show up, that becomes a vaccine management issue. Our team has also handled that beautifully. We have not yet wasted a dose of vaccine, which I think is incredibly impressive, and just a testament to how good of a steward our team is of this valuable resource. But we're reaching some inflection points here where, I mean, within the next month or two, we might be to the point where we're really trying to convince people to come be vaccinated instead of having people eager to come. So these are all things that we are paying attention to. I'm going to stop there.
African-American community being more reluctant, do you have any data on that? Seem to read that.
Yes.
Trust, that kind of thing.
Yeah, so I mean, we don't have local specific data on that. We have some anecdotes. We have worked a lot with Spectrum Health Lakeland's population health team. They've been really instrumental in helping. I know that they have hosted some community dialogues with leaders in Benton Harbor and communities of color to really try to hear what some of the concerns are, have medical professionals present to talk about and address some of those concerns in a little bit more personal of a setting instead of a mass out there. But I've been seeing some articles in national news that some of the more recent polls in our country is showing that there's not as much of a racial division in vaccine hesitancy as there may have been in polls last fall and earlier this winter. I didn't point it out on the slide, and I don't know if anybody noticed it. We seem to have more of a gender imbalance where females seem much more likely to have been vaccinated.
That's
I don't
why
know.
you guys live longer.
Toxic
Right. I don't know if it's
masculinity.
an artifact of a little bit of a difference there with the focus on older adults, or we do know that females tend to have higher health seeking behaviors anyways. So yes, I think definitely working to try to address that. I think some of the racial differences, and we don't have good data at this moment in time or access to analyze the data on the racial differences in vaccination rates thus far. But it might be more issues of access to the vaccine and some of the other issues. Our team has done a great job trying to help overcome some of those, but there's issues of transportation and trust just continue to be big issues.
But both nationally and statewide, the number of those who are African American getting the vaccine is really increased, and the percentages really, as Nikki said, really dropped. And that's true in our state too. So that's very encouraging.
Dr. Edwards, I saw you had a question. Yep. You're on mute.
Yeah, my just a couple of observations. Number one, Nikki, this will go down in your life with your staff as the proudest moment of your public health career. Mm-hmm. The efforts at Marion County are unparalleled in the state and have just been extraordinary. It's been marvelous to watch. You know, my own clinical experience with the reluctant patient echoes what you just said. It's really not been along racial lines. And fortunately, I've seen a little bit of a decline in the political resistance that we initially saw with this. What I am continuing to see is the need for continuous outreach from physicians to their patients. It's the first question we ask, and I'm an orthopedic surgeon. Have you had your vaccine? And do you know how to sign up? Again, my compliments. My question is this, vaccination passports are becoming a new hot political issue, and that's not going to be resolved anytime soon, but it does bring up a good point. If a patient has had a vaccination, how do they, what is their means for verifying that they've had that vaccination? In other words, I've had my vaccination, I've lost my card. Is that statewide? Is that local? How does a patient verify that they've had the vaccination?
So all the vaccines have been entered into the MICR, which is the Michigan Care Improvement Registry. So that's where immunizations are recorded in the state of Michigan. There is an opt-out option if somebody really doesn't want their information in there, but the default is that all vaccines are entered into this registry. So if someone does lose their card, there is a mechanism for retrieving that record in an official manner so that it can be shown to prove vaccination. However, our health department, we don't have the capacity to just reprint everybody's records, especially right now. We do have a process for that, and it does require verification to make sure we're releasing records to somebody who has the right to those records. But it's really important that people keep the cards.
Okay, Linda, and I think Dr. McBride or Ray, you had a question? Okay.
Two things. One, I think you're right about access and to the vaccines. I anecdotally my staff has, commented that at some of the large vaccine clinics, the racial component is 95% white and 5% African American. And I think that's really just an access issue, and perhaps, the times they're held, that people are working and they just can't get there. I mean, I don't think it's as significant as the hesitancy, but I just think that it's, where they are and how they can get there and that kind of thing. But my question is, we did a lot of work for the hospital and I think for you all in calling all our homebound clients, and what is the status of people who can't get to clinics, not just seniors who are homebound, but people who are disabled of whatever age. How is that going? I haven't heard anything about that effort.
Yeah, those are great questions. So referring to with issues of access. So yes, we've had our as we've talked about before, some of the larger scale mass clinics do tend to appeal to potentially a less diverse crowd, and more white people are there. However, we have also had lots and lots of small pop-up clinics where that has not been the racial makeup, where it has actually been more the other direction. So it's hard to judge the whole vaccination effort based on observation at a handful of clinics. We're working to try to make sure we have data to be able to actually present on that. It's been really hard to kind of get some of those things from the background. But just wanted to say that.
Yeah.
So in terms of,
I think your outreach into various communities has been really good. It wasn't a criticism. It was just an observation that
sure,
that the smaller ones and perhaps in churches are going to be more popular with different people. That's all.
completely agree. And I think that's been a hallmark of our strategy, and just continuing to try to balance the time intensity and effort of all of those, and knowing when we hit that saturation point. So anyway, so yes, we will continue to do that. In terms of the homebound, yes, Meals on Wheels and lots of other partners have been instrumental for months now in helping us to identify and then make contact with homebound individuals who needed a vaccine brought to them. So in the beginning, we sort of decided that that would be something that Spectrum Health Lakeland had more of the machinery and the apparatus to be able to do that. So they have been doing that on behalf of both the health department and themselves for the community. I believe at last I heard, and that was maybe a couple of weeks ago, through that homebound program, over 1,100 doses had been administered. So, and as soon as Johnson & Johnson was available for that, we switched to that product as well, because that's easier for everybody all the way around. And there was effort to always offer the vaccine to the caregivers living in that home as well, because we know there are access issues that might be a bit more nuanced for those individuals as caregivers. So that was something that we've been pretty adamant about working through this whole time. Have we gotten everybody that's homebound? Probably not. And I'm sure there are deeper reaches that need to happen, but I'm pleased that we're making progress. In terms of other people with disabilities, and not just seniors or others who may just have some transportation or access issues stemming from health concerns or care, we have been working with the Disability Network, and we actually have a targeted clinic this Friday for that group of stakeholders. It's a drive-through. It's with Johnson & Johnson. We've done things to try to maximize the accessibility for that population specifically. I don't know, Courtney, you've done a lot of the planning for that. If there's anything else you would add.
That's a good overview. I think this is where we're continuing to try to balance, is where are we getting out the high volume of vaccine that the community still needs, with finding those unique nuanced spaces where we need to also be prioritizing. And I think that's where we're really lucky in Berrien to have a relationship with our health system, who can help balance some of that vaccine delivery. And the health department we're a bit more agile in our model to be able to set up anywhere from a church basement to a fire department to a Mendel Center, right? Like we can kind of adapt through those settings. And so that's a lot of where we're focusing over the next couple weeks, of different places where we can even be in an apartment complex, because some of that homebound, you know, it's linked to individual housing. Sometimes it's in a larger apartment complex, and some of those larger facilities, to your point, Linda, it's not convenient to take Dial-A-Ride to the Mendel Center for a clinic when you don't know when to get dropped off or picked up. We have had people come on Dial-A-Ride, but in mass, that's just not convenient. So still trying to balance those community places and get out volume of vaccines. So that's kind of where we're trying to find that balance over the next coming weeks, and being just as accessible as possible. I think some of our strategy, we're not quite there yet. I think we still have this balance of needing to get out a lot and then finding these small like apartments or churches to be in. But I think we're also going to get to a point here in the next handful of weeks of needing to be where people already are. So there's an event happening somewhere, and we need to figure out how do we implement ourselves into that and kind of shift some of our model. We've been appointment only, and we're still needing to do that. And some of our vaccine, I mean, it's in multi-dose vials, so that just is difficult in and of itself. But we're probably come to a point we need to figure out, what does walk-in look like? What are the right settings for that? Because not everybody's lives can be planned 3 days out. And we need to, again, have the vaccine ready when someone's ready and where they're available. So I think there's been lots of iterations of what our process needs to look like. And we're still kind of living through a lot of those iterations.
Thank you. I saw Dr. McBride, Ray, and Miss Vanessa had a question, and Joe. Okay.
A couple of things. I mean, I try to pay attention to the data on reluctance. And as you note, I think there's been great leadership in the African American community that's reduced that discrepancy. The most hesitant group I'm seeing in the data are actually conservative white religious males. And so another reason we die sooner, I guess. But I'm not sure how you overcome. I mean, I've given up trying to convince anti-vaxxers. I've just given up. It's almost core to their belief systems. At what point, I guess, what is our target for population herd immunity? I mean, are we trying to get to the 70-80% level in the community, guys? You know, is our long-term target now that we're down to younger age groups? Is that our plan? Do we have a goal of herd immunity in the county? When do you see that perhaps occurring?
So the state has been pretty vocal about 70% being their goal for vaccination rates. And it does seem to be applied fairly well across the board when talking about doing some changes in specific work sectors about like testing requirements or things like that. They've said when that group hits 70%, they want 70% of everybody in Michigan. We know we won't get 100%, and that's okay.
Right.
And we recognize that. I'm not 100% sure what the 70 is based on, if that's feasible or if there's some other science underlying that. But 70% has kind of been the articulated goal. Dr. J, do you have anything to add there?
No, that has been the goal, is 70%. Where it gets a little confusing, some people say that's just based on vaccinations, where others say that's those for confirmed cases and vaccinations, all contributing towards that. And really, if you get the vulnerable populations in majority, like we're doing here, that really does make a difference in terms of what your ultimate health outcomes are.
Do you see that happening by the end of summer? I mean, what in terms of public health?
I can see that happening this summer for sure.
Yeah. Okay. No, that's true, because that means a lot for normalcy in the fall for schools and other institutions. So that's kind of what I was wondering. But you know, I mean, Dr. Edwards said so. Guys, you know, this is, to quote, you know, Winston Churchill, this is one of the finest moments you're going to have in your careers. Look, it's been 1918, the polio, and this are the three major public health moments we've had, and you guys are phenomenal. You know, and showing the four people who got, you know, here 20 years shows good administration and a good quality department. So people are here a long time. The Berrien County data look good that you presented, and this is one of your finest moments. So I'm just proud to be a part of the board and proud to know you guys.
Thank you.
Ray, did you have a question?
Thanks, Peg. I think first, just to reiterate and confirm what Dr. McBride said, I think we all agree with all those comments. I think, and some of my questions were answered, but we've learned a lot, obviously. You guys have learned a lot. We've learned a lot as being board members are slightly removed from the day-to-day mechanisms going on with this. But the thing that I've always, I don't want to say got concerned, because I think we're doing everything we possibly can, but the accessibility that people have had, at least to this point, with now seem to be getting more thoughts of events that are going on. How can we get more people involved, smaller churches, smaller faith communities, et cetera, to host events for us or help us host the events? Is that part of it, I think, has been convenience of people, not convenience so much, accessibility for people to get to some of these sites. I got on the list of the volunteers for the events, or the clinics, and haven't had a chance to volunteer yet, because I wanted to make sure I went all the way through my second shot, and it was 2 weeks after that. So next one I'll probably sign up for. But if you just kind of see where the map is and where people are, and people that I've interacted with, and even people in my own family, other states, what we've had to go through to get the person to the shot, to the injection, to the clinic. It's been some pretty monumental things that we've been doing. And in my personal case, I'm doing this 500 miles away, and have had people that have been in the medical profession in Pennsylvania, where my family is, not being able to get done what I was doing from 500 miles away. It was just kind of incredible, of the network I had to develop to find where these things were going to be. And county-wise, it was a little bit smaller county than ours, but the same kind of situation, a good primary care hospital facility and network, pretty reasonable health department from what I could read and understand how they were doing things in Pennsylvania. But I think the same problem existed there, exists here to an extent, where how do you get people notified? How do you help them get onto the list? How do you break through to them to contact, to make an appointment, to understand where these places are, whenever you have population that may not have smartphones, may not have computer, may not have internet, and these are the processes they've had to go through. I think the outreach from the government side to the people has always been maybe not there so much as the people to the government to try to get where that facility is going to be, where that clinic's going to be. But I think we're doing everything we possibly can, which is the important thing, and how some of these things are falling into the aspect of notifications and transportation and all these things. No matter what you do, those are always going to be an issue. And the more partners we can come up with is going to be, I think, the best solution for that.
Yeah. And I think having how the provider network is expanding, and then will continue to expand, I think will help address some of that. As Courtney mentioned, we really are the most agile vaccine provider. We can go and are willing to go places and want to serve some of the people that others may not want to. So we're trying to probably within the next month reach a point where those large scale clinics are happening from other providers. And so like the mass amount is happening elsewhere to free up our time and energy.
How we can start pinpointing and targeting where those, as you said, apartment buildings, apartment complexes, like that. Fantastic.
Yep. So we're trying to do that, but it's difficult to thread that needle. And as a country, as a planet, I mean, we're all trying to build this process while we're doing it.
And we're going to have to keep on addressing.
Good job at what's going on. I have to congratulate you.
Yeah. Okay, Miss Vanessa, and then Joe. It's hard when we all talk at once, so sorry to be directive. So.
Okay, my question, I know that Dr. McBride and Dr. Johansson guys do a lot of reading. Has there been any contrast and comparisons made between what we're going through now and maybe the Spanish flu, or even more recently, Ebola, to see what worked how we came out of it, how long it took, and things of that nature. I know Spanish flu was a long, long time ago, and we didn't even have immunizations then, but any comments on that? Because I think it's important, because we may be facing this again. And just like Nikki said, we are building this process as we go along. And I just think it's all the information that we have is helpful. But I don't know, that was just something that was in my mind.
So from a Spanish flu standpoint, I mean, yes, you're right. It was before vaccinations. The other thing that was dramatically different about it was it really, really hit young people. So that's one of the, I guess, if you could say, fortunate things about this pandemic is it has spared young people, and they've, by and large, dramatically not been affected. So, and of course, then we have a vaccine. We have vaccines now, which didn't exist back then. So there are similarities for sure, but that was quite a bit different in terms of contagiousness. It was similar. Ebola, on the other hand, is something that several of us know. We've actually had a nurse that's worked over in Ebola territories, and some physicians from this community have also. And Ebola is not nearly is very hard to catch, actually. And so that's from that standpoint, a different animal. If it ever changed to being really, really contagious, of course, that would be terrible with its huge mortality rate. So yeah, they're both, have been miserable pandemics, but in lots of ways quite different. In part with the Spanish flu because of time.
Thank you. And then my last question was about the 16-plus-year-olds that are you seeing where they're signing up and getting their immunizations?
Yeah, we absolutely are. And we had a conversation the other day about how we need to rearrange things and how they're situated now that we're seeing more teenagers coming in with parents. We need more chairs together, not just single chairs, because we've got more people coming together that way.
Dr. J.
So just Joe asked a couple of very good questions yesterday, which I think we should address. And one of his questions is, why is Michigan right now basically the highest number of cases compared to other states? And that's a very, very good question. And some of the experts have been weighing in this for a while, even before Michigan reached that point. Why certain communities, certain states, et cetera, are doing it. And if you look and so some of the experts have mused that the reason that states like Michigan might be really the highest now, and we are, is because we're doing catch up on the number of cases. And we had a more susceptible population. And because of lockdown activities, a lot of the people who could have gotten it didn't and are still now susceptible. If you just look real quickly at our neighboring states, we have a population of about 10 million. We've had 780,000 known cases. Wisconsin has 5.8 million. They almost have as many cases as us. They're in the high 650, 660. Indiana, just across the border, has 6.7 million population, about 2/3 of our population. They almost have as many confirmed cases as we do. They're well over 700,000. So all of our neighboring states have 20% more, or even more than that, cases than we do. So are we now just not catching up our vulnerable populations as people have loosened up, as we've loosened up? Is that the reason that's happening? And that is the thought of many, many people and many of the experts out there at think tanks and at Johns Hopkins and other places like that. So that's one explanation. Second explanation is, and I'm sure that's at least one of the explanations. Second explanation is, what is the role of the variants in Michigan? Do we actually there's some evidence that we have a higher number of variant cases than some of the other states, us, Minnesota, New York, a few others. And is that a driver to why we're seeing a higher number of cases now? Only time will really tell on that. I believe that both of those two things are really factors, but we really were an undernumbered in terms of cases state for sure. So those are the two big things. I hope that helps answer that question a little bit. And Joe's other question was about vaccinations. Why you've probably seen some of the news reports, 200 or so people in Michigan who were fully vaccinated and 2 weeks beyond their second vaccination got ill with COVID, and 3 of them died. And so I was kind of perplexed by the state's answer to this. They're looking into it, but like kind of shocked. This is going on all over the nation. There was just a news article about like the smaller state of South Carolina. They have a series of 250 of exactly the same kind of cases. NBC News in Chicago just presented a case of a young woman who had gotten the vaccine, then got ill. She wasn't hospitalized, but got seriously ill. That made really, really big news. Then she got better 36 hours later. But those are big news. But we've always known that just like with the flu vaccine, there were people who will still get it and actually will have tests that turn positive. The difference is that very, very few of those people will die or become seriously ill and end up in intensive care unit, et cetera. And that's been true of this too. Of the 3 deaths, we don't know all the demographics about the 3, but they were all over 65. And since at the time period this study was happening was when we were doing nursing homes, it's no surprise that people who have been vaccinated are going to die. And also we did vulnerable people who had cancer and other things like that. So there are people who are going to test positive and die. I mean, so I hope that answers those questions, Joe.
Yeah, it's helpful. Thanks.
Joe, did you have any other questions or were
I did. I did have one question, and I was just going to mention, it's not my question, but when I was in Florida is when we got our vaccine. They had in Sarasota, the day I went in, there 3,000 people got vaccinated that day at the one center. It was a massive operation. That's pretty typical, but I don't think they've had the wherewithal yet to do the focusing in smaller subgroups like we've been able and so fortunate to do in Berrien County. Anyway, my question was, in the hospital, we would require all staff to have a flu vaccine annually, unless I would get a doctor's approval to that they wouldn't be suitable for them. The question I guess I have, is there any, I've not seen this, with a hospital, nursing homes or whatever, having any kind of requirement for staff to be vaccinated to protect the patients and others that come into the hospital?
So we've heard nothing about any consideration of that being a requirement. I know there's lots of encouragement and incentivizing to try to get folks in those types of settings to be vaccinated. I'm also just a little bit unclear as to whether or not legally these vaccines can be mandated, because they are not technically approved. They're just authorized for emergency use. So that's a little bit different. I think if and when they do get a full FDA approval, that might be a different story. But while we're under the EUA, I don't give legal advice, but I'm not sure that is something that would be really advisable or something that would be a good idea.
I think what Nikki said there, that's exactly what they're not going to mandate it until, or make that a requirement, like with flu vaccine at Lakeland Spectrum, for instance. That's not going to happen until it's beyond the emergency use authorization. There'd be just too many legal challenges.
Linda, did you have a comment or question? Or Joe, did you get all your questions answered?
I did. Thank you.
Okay.
I did ask that question, given that we serve such a vulnerable population, and we got basically the same answer: to encourage people, but we can't require it. And so that gets into this whole, sort of touches on this whole question of people demanding to see whether somebody's been vaccinated or not. And that's when we start reopening the senior meal sites. That may be something that comes up that we'll have to deal with, because in my opinion, revealing whether you've had your shots or not is protected health information. And I don't know that people are going to be comfortable sharing that. So it's going to get more interesting.
Dr. Edwards?
Yeah, Joe brings up a very good point about mandating vaccinations. I can tell you that's an enormous third rail that will not be touched by Spectrum Health. However, it does bring about a very important point that this board and the health department needs to continue to reiterate: wear a mask. We are not anywhere near the end of this. And if anybody has the impression that immunization sort of precludes the need to wear masks, unfortunately, they are mistaken. And we need to continue that message very loud and clear, both in health systems and all, elderly facilities, but really in public spaces.
All right, Vanessa, one more question, and then Dr. Harrison. Sorry, I missed your hand before. So Vanessa and then Dr. Harrison.
Oh, I had just been reading something about the shot is good or it lasts for about 6 months or so. Can anyone speak to that? It will protect you for 6 months or something like that.
Dr. J, you're on mute. Dr.
Sorry.
J, yeah.
Sorry. So that's as far as the studies have gone out now, just because of when it was all started. But it is anticipated that very soon it will be moving to 9 months. There's good evidence now that it's 9 months and well beyond. So in terms of both antibodies and T-cell immunity, and all of the 3 vaccines that we're using have all shown great response way down the road. So it's great. So I'm sure that's going to be extended.
Thank you.
Dr. Harrison, do you have a question, a comment?
From a higher ed perspective, there's growing attention to the universities requiring students to present evidence of a vaccine before they come back in the fall. And so I know there's some active discussion going on now at U of M and Michigan State. And if they decide to do that, then everybody else will fall in line. And then the governor is pushing out some J&J vaccines to the colleges, asking them to get everybody vaccinated before they leave from the spring semester. So I think we'll start to see that pick up pace here real soon, with or without a formal authorization. The universities are just going to try and clean things up before the fall semester starts. That's it.
All right. Seeing no more questions, hopefully I'm catching everybody. Dr. J, your medical direction.
Sure, thanks. So last time I talked about people, I was going to talk about programs. There's too many programs for us to go through, so I won't go time-wise with you. But I will say in April, the head of the state health department came and visited Berrien County. Now, I'm not talking about this April. I'm talking about April 1982. So I'll tie history with today. It was Dr. Bayless Walker, who was the first African-American head of the state health department. And he and Dr. Harrison, a different Dr. Harrison, he was the medical director, came to our health department, met with you guys, the Board of Health, and met with our county commissioners. And Dr. Bayless Walker had a very distinguished career. He went on a few years later. He was appointed by Governor Milliken for the state of Michigan. He was an environmentalist. And he, a few years later, had left, as what happens to political appointees, and was the head of the American Public Health Association. And so he was the APHA president for several years. And he was also the founder of the Black Caucus, the first caucus of APHA, and was a very active man throughout his life. He died this past spring, unfortunately, having been for many of his last years a faculty member of the medical school of Howard University. We trained at a similar place in New York. So I was interested in meeting him when he came to visit us. And here's the article from the Herald Palladium. It was the lead story in April 1982. And I think it applies to today, which is why I'm bringing this up. Walker praised the Berrien County Health Department in his address to the commissioners and health department as the most progressive and aggressive health departments in the state. So this was way back then. And I would say it just for all the programs that have happened in between, we've done things that the state said we necessarily maybe shouldn't, like nurse family partnership. We addressed in the year 2000 an infant mortality summit, doing discrepancies. We were the first county on the west side of the state to go smoke free, which was big. We were very big in environmental stuff, which he noted, including when he was here, in lead poisoning way back in 1982. So the number of times we've gotten awards and been recognized and done innovative programs that have helped our community, you just go on and on and on. Our HUD lead grants, et cetera. So congratulations to all of you, the Board of Health, and our health department leadership for the things that we continue to do. And I would say the two dramatic things that we've really done have been hit on in terms of vaccinating, and we really did prioritize seniors, which I have no doubt was the right way to go. Not everybody went that way. We did. It was, in Dr. Walker's things, progressive and aggressive, and we did it. And the other thing is we also had in-person learning. We're probably number one in students in-person learning. That was not an easy task. Nikki and others worked tirelessly along with our school superintendents and our ISD to make that happen. That didn't happen by accident. And it fits what Dr. Walker said a million years ago. Sorry about the ancient history. You can read about it in the 1982 Herald Palladium first page.
Thank you so much, Dr.
Sure.
J, for everything and how you
Sure.
set the pace. All right, thank you. We've had a governor's visit. Thank you for sending out the pictures. That was great, Nikki and Courtney.
Yeah, thank you. And I mean, I think maybe these were the same ones I had emailed out, but just put the slide together here with a couple of the pictures. It was really an honor to be able to have the governor. It's not every day a governor gets to come to your health department and see how things are operating. So it was really great that we were able to do that. We had other folks here as well, some distinguished community members from Benton Harbor, as well as Representative or Congressman Fred Upton, and we had a representative from Senator Peters' office as well. The governor did award the governor's coins to some National Guard members, as well as our nurse Candy Gabriels, as you can see here in this picture, based on their response to a medical emergency that was not vaccine related and happened pre-vaccination, but that happened at one of our clinics, and some of their just really brave and swift efforts in that regard. So it was really wonderful that we had some of the majors from the National Guard present, and none of the Guards service members that were here that day knew the governor was coming. So there was just a lot of excitement in the air, and that was really an honor for them. So it was wonderful to be able to host that, show off what we are doing here in Berrien County, and just commune with some of our partners around this effort. This is a historic moment in time, not this visit, but this pandemic, and how we're all really working together and forging new partnerships. So we're grateful that our office was able to be a setting for some of this on this meeting, and that our staff had that opportunity to be recognized at that level.
Oh, that's great. And I'm sure you were thinking that's another thing that you did. So thank you.
It was definitely a little bit of a scramble. They don't give you a lot of notice.
All right, good. Thank you. Dr. Harrison, do you have a report from the Board of Commissioners?
Sure, just a couple things to highlight. We've wrapped up the broadband survey. I think we all know that broadband has really played an important role in trying to get our people registered for their vaccines. So we'll be looking at that, the results from that, and then we've started to talk to some of the private vendors that have received federal contracts to expand broadband throughout Berrien County. And so that ties into a bit to the COVID-19 money. The county will be getting $29 million. And so we'll start that process looking at one-time investments in infrastructure, like, the health department's IT needs, the telephone needs and the like that have been critical during the COVID outbreak. Brian Doucette's also going to start a strategic planning process. He's hired Jim Hettinger a guy that was an economic developer in Calhoun County to come in. He's wandering around the county, talking to people. And so he'll be working with the county board during that strategic planning process. We did pass a resolution declaring a state of emergency so that it will allow for public bodies to meet and still comply with the Open Meetings Act, as well as the health department restrictions on people from different pods meeting together to talk about issues and still remaining compliant with the 6-foot distancing. So that will continue on till the end of June. And then we did send a resolution up to Lansing, not that anyone really cares what we think, asking that the state, the governor, and the legislature agree on releasing $5 billion in COVID money that came prior to the end of last year. Because of the lack of agreement, they're just kind of sitting there, not using the money that we think could be put to good use. And then we will start the process for reopening the administration building, still requiring sign-in, temperature testing, masking, and then still have all our shields to protect staff. So that process actually started this week. And I'll be glad to answer any questions you might have.
Just thank you for the broadband and living on the other side of the digital divide. I really appreciate it. So thank you. Yeah. And thank you for your report. Now is the time for the Board of Health. Any additional questions before we look at whether there are any public comment? No? All right. Have there been any public comments?
There has been no public comments at this time.
All right. Well, again, thank you for the extraordinary work you've done, Nikki and Courtney and the whole department. You look exhausted. I hope you get a break.
I don't think they look that bad, but yeah, they do look tired. They do look tired.
We definitely have been joking about how when this is all done, whenever done is and what that looks like, we all want to be quarantined so that we can just stay home for 2 weeks and not have to talk to anybody. But yes, thank you for your support. We definitely appreciate it.
Yeah. All right. So seeing no other comments, we stand adjourned. Thank you for the good meeting and good data.
Thank you
very much.
You all, bye.
Hi, everyone.